Good morning, everyone. My name is Guozhen Huang. Today, I'm very pleased to have a chance to introduce mini Zen acupuncture therapy. Before I introduce this mini Zen acupuncture therapy, I would like to introduce myself first. In 1983, I entered into traditional Chinese medicine college in Nanjing. We call Nanjing Traditional Chinese Medicine College. My majority was studying Chinese medicine and graduated from 1988. And after that, I got my master degree of medicine in the same medical school in Nanjing, and then went to the Beijing, Peking Uni Medical School and did my doctor degree of medicine. And in 1998, I came to Canada as a postdoctoral research in the University of Manitoba Medicine School. My research project that time was on the liver fibrosis and then for the breast cancer research. From 2005, I started to open my acupuncture and Chinese medicine clinic in Winnipeg. Since then, I have been working in my clinic almost 15 years. Of course, during those period, I had lots of articles has been published, and also I have 2 books published too. One book is for single Chinese herb medicine application in that clinic. Another book is focused on the single acupuncture points application. And these 2 books are also just published in this year. Again, I say republished. So in the last 15 years, I did lots of clinical work for my patients. And right now that I would like to introduce or to talk about why I am doing mini Zen acupuncture in my clinic. What's the advantages and benefits? Why I choose that? The reasons. As you guys know that when you work in that acupuncture clinic, most of our patients are suffering from a pain, all kinds of chronic pain or acute pain, like sports injuries, ankle sprain, or chronic low back pain, neck shoulder problems, sciatica problems, disc herniated, all kinds of chronic pain patients. I think that in my clinic, 70 or 80% of my patients are pain related. And of course, as a regular acupuncture, that works very well for pain management. But to my experiences, I found if I just do regular acupuncture therapy, and the successful rate is around 60 to 70%. Still 20 to 30% patient, you can't help them to relieve the pain. Typically, when you find the pain caused by some kind of scar tissues or some nodules, or right now we say the trigger points, you just use regular acupuncture, tiny needles, most of the time doesn't work. And also, most of the time you just feel kind of useless because when patient come in, show you, hey, doctor, I have a pain just in front of my chest. For example, on the pec measure, that you can find that big nodule there and very tender, very painful. But when you do regular acupuncture treatment, you use needles to stimulate this point, doesn't work. Even that you do whatever, how hard you work on the point, the pain is still there. The time I really want to know how to use some knife to break up, to cut this kind of nodule. I believe that pain will be gone right away after that. But at that time, I don't know. I don't have any idea and knowledge of that live needle. Of course, I heard about that, but of course, in Canada, I don't have those kind of needles available, handy in my clinic. And even I do have that, I don't know how to perform it because I scare the life, the cutting, for the patient. It's kind of like surgery. But of course, the patients, they are in front of you. They are waiting for you, your help. So what can you do? You have to work very hard to find a way to resolve the problems because I say maybe around 20 to 30% patients have this kind of problem or this kind of thing related, the pain. So starting there, and then I'm searching for different kind of therapies from all kind of three needle therapy, scalp acupuncture therapy, full acupuncture therapy, blah blah blah. You can see, and I couldn't find anything really can help me to resolve this kind of problems. And then that I'm looking for the life leader we call Acupuncture-Miracle therapy. And this is invented by the Dr. Zhu Hanzhang, which this I will introduce his profile after a while. But I got the video from internet. I watching how does that perform that treatment. But I give up because that kind of process is kind of overwhelming to me because it inserts needles very, very deep tear to the surface of the bone and also from the treatment location, lots of bleedings. So I guess that it is not working for me as I'm working, in Canada, that I don't want take any risk to help my patient because the safety always the number one issues. But I know the needle with knife, with a blade, it really can help to break up those kind of superficial, the nodules or trigger points, either way on the fascia or in the muscle. But these techniques, I can't take it. I can't use it because it's scary to me. Anyway, that I find another doctors. I think Dr. Wang Junqi and another doctor Hu Caowei. They use the live needle. I mean needle with a blade, but very tiny. They work on the surface of that skin, fascia, or the muscle. But it is very, very amazing, that when you look at those kind of treatment and almost no bleeding and without any freezing, the treatment first, without any drugs, patient can perform this kind of accept this treatment very smoothly, very comfortable. So I think, oh, that is what I want. That's why I'm just looking for studying this kind of that treatment. So this is why I'm studying that mini life leader therapy. But I call this treatment in Canada, in my clinic, I call mini Zen acupuncture therapy. Okay, so that's the reasons. First of all, we know mini means small, tiny, lovely, right? So when you show patients, hey, look, the needle just like, we're tiny like that, patients can accept it. I don't want to scare my patient when I show the big needles, of course. And then, of course, Zen is Chinese, pronunciation of the blade. So we call Zen. Acupuncture means needles. So when I introduce my patients, say, hey, this techniques we call mini Zen acupuncture. All my patients accept it. Say, oh, nice. Very nice, very tiny needle. That should be okay. And then that the purpose I want this name to promote, that the application in Canada or in other countries except China. So far, in the last around 5 to 10 years, actually, I have been using this kind of therapy. Actually, I choose very successful result for most of my patients. So that's why I would like to introduce this kind of therapy to all acupuncture therapists or any other healthcare providers who perform acupuncture to help your patient. Okay, so next, let me just show you that one kind of radio, give you guys, the view of that my treatment. How does it work? Okay, so this small that video clips that is a patient, who is at the coach of a volleyball and the club. He has been that as a coach over 15 years. So he used lots of the right arm, you know, to practice, to train those kind of players. So he has lots of chronic pain on right shoulder area, include his chest, his neck, his shoulder, the blood, and also his upper back. So with this treatment, I give him very quick diagnosis and assessment and find some muscle cause the problems. And the muscle, because it has some kind of scar tissues, stuck on some kind of insertion and origin part of the muscle. So I perform this mini Zen acupuncture to this patient. After a few minutes treatment, he got up. So from his face, you can tell he's very happy with the treatment because he said his pain is almost gone. And also his range of motion has been improved. That very, very happy for that, result from there. So, and also you can tell my treatment seems very easy. Find some part, just needles, poke in, take out, that's it, and find places and then perform the needles inside. That's it. And the whole treatment, that process, only take around 3 to 5 minutes. And I didn't use any kind of cupping, no massage, no manual therapy. So that's very simple, right? Okay, after that, and then I would like to introduce the mini Zen acupuncture. So here that we talk brief introduction of mini Zen acupuncture therapy. Okay, so first of all, I would like to talk about the definition of mini Zen acupuncture. So here I say the mini Zen acupuncture therapy is developed on the basis of traditional small needle knives to target superficial fascial nodules, muscle spasms, scar tissue adhesion. It is a very effective, revolutionary, minimally invasive therapy to treat various soft tissue injury pains, nerve compressions, dysfunctions, etc. Okay, when we talk about that, you will ask, hey, that where when we do have this kind of uh, live leaders, okay, so how long it has been that in China, as acupuncture therapists use the live leaders? Okay, so here I want to talk about that the origin of this mini Zen acupuncture actually come from that almost 2,000 years ago from the Chinese medicine book we call Neijin. It has a line, different kind of type of needles, and you can see the pictures. They all have different kind of size, different kind of shape, and works for different kind of disease. First of all, that we, of course, this part, it's hard to translate to English, but briefly, I just introduced that line, different kind of needles, the name. First of all, we call 10 needle. It also looks like um, a row. The needles looks like a row. That yeah, is kind of sharp on tip of the needle. Usually, we treat the heat or fever, the disease, and then directly put on the needle, and then take that to uh, to to treat the fevers of the body. Second needle we call the circle needle. Those needles, that looks like the egg, not very sharp, and then that usually we use that for the massage on the surface of the body and to treat any kind of fascia and soft tissue, the sore and the pain, but not invasive that skin and the muscle. The third one we call Dizhen, and also use that as the massage. And also we use that for the kind of the the weak patient or the pain patient. And the fourth we call Fengzhen because of the feng is very sharp. And also usually it has 3 edges of sharp edges. So we call 3 edge needle right now. Usually we used for the bloodletting therapy to treat all kind of fever, infection disease, or some kind of that the boil or kind of chronic joint pain conditions. The fifth we call the pigeon. It is also kind of looks like that the sword, and both sides has that very sharp the edge on both sides. Usually we treat those kind of that infected wound to drain the pus and blood from that skin areas or the muscles. The sixth one we call Yuan Li Zhen. It's kind of needles right now we use, to stimulate the muscles, typically for spasm muscles, to release the tightness and spasm of the muscle. The seventh we call Hao Zhen. Hao Zhen means that it's very, very tiny, very thin, the needle. It has different kind of size. So right now that in our most of acupuncture clinic, our needle, they are all the kind of Hao Zhen. The eighth one is called long needle. The long needles, it can go to around 7 inch or 10 inches longer. It usually works on the big muscle areas like in the buttock, like sciatic pain and piriformis problems, and it can go to deeper. And also we use this kind of needles to pass the needle from two different kind of points, and then to stimulate the few points with one needle, one treatment. Last one we call 大针, means big needle. Big needle right now that usually not really big, but usually around 4 inches. But right now people use that as a fire needle. The fire needle, we can introduce this in the future to treat all kinds of cold and dampness, chronic pain, cold and damp and chronic pain in the joints or in the muscle. Okay, so right now that I would like maybe introduce a little bit of the Dr. Zhu Hanzhang, who is the inventor of that Acupuncture-Miracle in China. Actually, he invented this kind of therapy in 1970s. The time he was, we call, barefoot the doctor in China. Anyway, so because this slide shows the size of that Acupuncture needle, so it looks like that it has the blade on tip of the needle, and hands hold these areas. This is the trunk, the needle body. It has different kind of sizes from 0.4, 0.5, 0.6, 0.8 millimeter. The width of the blade. It can go to deeper from that, that 30 millimeter, 40 millimeter, 50 millimeter, 80 millimeter, and even 100 millimeter. But right now, most of the time in the clinic, we use this size, and it is very, very rare to use that big needles like over 1 millimeter or 1.2 millimeter. That the weight of that needles, because it's quite painful. But of course, it works very good for some kind of chronic and very deep and huge and scar tissue adhesive problems. Use wider the blade needle, always get better result. But of course, you will take a little bit more risk, maybe to injure or damage the nerve, the blood vessels around that areas. If you are not very familiar of the anatomy of that areas. So I would like you guys don't use that. Just use very small size for safety issues. And also you can achieve the best result. Okay, here is a kind of profile of the Dr. Zhu Hanzhang. I say from 1976, he started to use the live needles. And then He believes these needles work on the body, not just because life, not just because needle. It works like both the benefit or advantages of the needles and the knife. Because needles, just like acupuncture needles, can stimulate your body, stimulate nerve systems, and help to manage the pain, help manage inflammation, and also help, that to relax all kind of soft tissues in the treatment. But of course, used as a knife, it can directly to break up those kind of scar tissues, the nodules, and adhesive, that tissues around compressed nerve, joints, muscle. So that's why it can achieve the best result than most of our regular acupuncture needles. Unfortunately, Dr. Zhang died in 26 when he was only 57 years old. And of course, he published few books in China to introduce that acupotomy therapy. Yeah, so that this kind of books he published in China in 1990s. Okay, so here that I would like to introduce the mini Zen acupuncture needle and the regular acupotomy needle, the differences. So this is kind of needles I use in my clinic. Looks like exactly, that when train the regular acupuncture needle, but the blood weight is 0.35 to 0.5 millimeter. This is kind of different types of that acupotomy needle they used in China in the hospitals. So this kind of that needles. Okay, so I'd like maybe to introduce this part in next lecture. But anyway, I just talk about what I fear, what I saw before when that the kind acupotomy expert to perform treatment to some patients. I will say it's kind of horrible and overwhelming to me because those patients screaming just incredible, painful. So today I say I'm very happy to have a chance to introduce some basic concept of the mini Zen acupuncture. Of course, I will teach you more and more details and of mini Zen acupuncture and how to use them, how to use it to treat all kind of different kind of disease. Actually, that mini Zen acupuncture, it is not just for the pain. It also can also help lots of other issues, even that the sinus, asthmas, heart disease, and that to lose weight, and yeah, lots of things we I would like to introduce you guys in the future. Okay, today we just stop here and have a good day. Bye bye.